In order to help stabilize and maintain the structure of the body, the human spine curves slightly at the neck, upper back, and lower back. These curves are known as the kyphotic curve and the lordotic curve, and they play a large role in supporting the weight of the head and aligning the torso properly over the pelvis. However, certain lifestyles and conditions can intensify these curves, leading to either kyphosis or lordosis. The most common cause of kyphosis can be attributed to poor posture, especially in adolescents who haven't finished growing. Excessive slouching can stretch the developing spinal ligaments out of their normal positions, causing a hunched shape in the spine. Extreme cases of kyphosis can even cause back pain, muscle stiffness, and difficulty breathing. Lordosis may occur more commonly among dancers or gymnasts, but can affect people of all ages. Both of these spinal deformities can also be caused or worsened by conditions such as osteoporosis, arthritis, and spinal fractures or tumors. Certain neuromuscular conditions or genetic disorders can also cause the spine to curve unnaturally from side to side, resulting in a third condition known as scoliosis. For most cases of spinal deformity, spinal specialists will prescribe targeted physical therapy to strengthen the back muscles and improve posture, in addition to back braces for children to assist in correcting deformities as they grow. For the most extreme cases, patients may have to talk to their spinal specialist about the possibility of minimally invasive corrective spinal surgery.